Okay, I'm back. I was gone and then I was back and then I was gone and then I was back. And who knows what's happening. Hello. My camera seems to be going on and off tonight. Please indulge me. My camera seems to be going on and off tonight. No, it's not a new system. It's probably the whole shtick. Here we go. I'm back. Hopefully you'll see me in a second. God. Sorry, I've gone off again, even though you're seeing me now, evidently. Don't pull another Biden. Well, don't tell me Biden. Well, let's hope it holds the camera this time. Held the camera for about 5 seconds. Happy Monday. Should. Uh-oh. Ah, there I am again. Hopefully this will hold the setting. Can everybody see me and hear me now? Oops. That was briefer. But it's still going on and off like there's no tomorrow. So I'm going to start up, however. The title of this is The Next Round. The Next Round. What is it the next round of? It's the next round of the struggle for justice amidst the coronavirus crisis. And Steve says, love the new dark Facebook background. That's not a new dark Facebook background. That's just me turning off the background lights. I don't know why I did that. I guess I felt like turning off the background lights. But here we are anyway. So look, the struggle has already started. So let's start going over some articles that talk about it. Well, progressives, actually Bernie Sanders said, corporate-run health insurance isn't about saving lives. It's about making as much money as possible. With Medicare for All, we can finally put an end to this international disgrace. And the headline for an article in Common Dreams by Jake Johnson on March 30th, which was this morning, said, quote, abolish for-profit health insurance, unquote. Analysis warns companies could hike premiums by 40% amid the pandemic. So they're telling us that our wonderful health insurance companies that everybody loves, according to the mainstream media, everybody loves their health insurance company and prefers their health insurance company to a government-run health insurance program. Well, those companies could hike already exorbitant premiums by 40% or more next year. I wonder how much Americans are going to love their insurance companies when that happens. Somehow, I don't think we're going to love our insurance companies very much. This is according to research done by Covered California. The state insurance marketplace created under the Affordable Care Act. And there's a link in the article to a PDF. Quote, if carriers must recoup 2020 costs price for the same level of costs next year and protect their solvency, 2021 premium increases to individuals and employers from COVID-19 alone could range from 4% to more than 40%. Well, that's a great range. I mean, I'd like to know where that's going to be, but I suspect it's going to be closer to 40% than it is to 4%, don't you? Judd Hollander of Thomas Jefferson University said, they're doing healthcare to make money, not to take care of people. More than 80 million people in the U.S. are currently uninsured or underinsured, according to the Kaiser Family Foundation. And millions more are losing their employer private insurance as the jobless rate spikes due to the coronavirus crisis. Isn't that the truth, folks? Isn't that the truth? The impact of COVID-19 will be significant, and absent federal action, consumers, employers, and our entire healthcare system may be facing unforeseen costs that could exceed $251 billion. Consumers will feel these costs through higher out-of-pocket expenses and premiums, as well as the potential of employers dropping coverage or shifting more costs to employees. These increased costs could mean that many of the 170 million Americans in the commercial market may lose their coverage and go without needed care as we battle a global health crisis. And Lee added, these are not insurer costs. These are costs directly borne by individual Americans. Public Citizen called for the United States to abolish for-profit health insurance. And Bernie Sanders, whose Medicare for All proposal would virtually eliminate private insurance in the U.S., tweeted in response to the covered California study that America's for-profit insurance industry is not compatible with health care as a human right. And he said, now is not the time for greed. Now is the time for Medicare for all. I think we can kind of all agree with that. But there is one person who does not agree with that. And his name is Smokey Joe Biden. I like to call him Smokey Joe. Don't ask me why. He hasn't been smoking very much in recent years, I don't think. As coronavirus exposes deep flaws of for-profit system, Biden doubles down on opposition to Medicare for all. This is another article today. This one is from Owen Higgins at Common Dreams. And of course, this is based on a video, an interview at MSNBC that Joe Biden had, which you can also see. And the link is in this article. And the important thing is that Yasmin Vossegian, I think that's how you pronounce her name, was interviewing Joe Biden, and she asked him, given all that's been happening with the coronavirus that has already killed over 2,300 people in the country. Actually, I think it's killed more by now. She asked him, are you now reconsidering your position when it comes to single-payer health care? And Joe, of course, said, quote, single payer will not solve that at all. And Andrew Gerald Jones, Luke 137, tweeted, after again complaining that Trump does not listen to the experts, Joe Biden continues to not listen to the experts himself, as well as Democratic primary voters and Bernie Sanders, in still hating Medicare for all in the coronavirus. And Elizabeth Brunig tweeted, I don't think anyone's arguing that single-payer health care would prevent diseases from happening, but rather that it would prevent financial ruin and care delays for millions of people. Would love to see Joe Biden debate this important question. I don't think Joe Biden's going to debate anything else for the rest of the presidential campaign, because he'd be afraid he'd lose 20 points on the debate. Of course, Biden's remaining rival for the nomination of the Democratic Party, Senator Bernie Sanders, has made his outspoken support for Medicare for all a central plank of his campaign. Critics of the former vice president bemoaned his doubling down on a position which seems sure to result in electoral ruin. This is a losing politics, tweeted The Nation, the literary editor David Marcus. In almost every state that's held a primary so far, including those Biden has won, exit polls show a majority of Democrats prefer a single payer. Well, maybe a majority of Democrats won't vote for Joe Biden if he's the nominee of the Democratic Party. Could it be? Could it be? The question for the U.S. would be better suited to handle the crisis with a Medicare for all system has persisted throughout the coronavirus outbreak, which is expected to get worse and peak in the coming weeks and months. Yes, the estimates by the Trump administration for how many will die as a result of the coronavirus uh, have now have now gone to between 100,000 and 200,000 deaths before the crisis is brought under control. Okay, in other words, during the next year, before the vaccine is here. And progresses mourned a California teen who died last week, likely from the coronavirus, after being turned away from a hospital for lack of insurance, and questioned the viability and morality of a healthcare system with something like that could happen during a raging pandemic. How can anyone defend the system? Tweeted Class Sandburg, the Sanders campaign's national organizing director. Treatment must be free for all. And Bernie chimed in and said, this is absolutely barbaric. The cruelty and absurdity of our for-profit healthcare system is more obvious in the midst of this crisis than it has ever been. We need Medicare for all. We need Medicare for all. By the way, there's a little thing on the side of this article that says that as Trump's lies and boasts and deadly fictions mount with the virus, we now have a record 82,404 cases. I thought I saw today that 2 days later, after this quote of 82,404 cases, the number of cases had gone up to more than 140,000. An increase of 60,000 over 2 days. Over 3 days, I think, is what happened. So, what caused it? Well, what caused it is not that people suddenly got sick over the 3 days. It's that we're finally testing now in large quantities of tests. And since we're finally testing, we're confirming that there are all these cases out there. Now, how far the testing is lagging behind the number of cases that are out there, we do not know. But it's still likely to be a factor of 10, I suspect, that we're probably looking at something like 1 million cases now in the whole country. Some people may think that that's an irresponsible estimate, but I bet John W. Campbell, the English epidemiologist who's been tracking these things, would probably agree with me that given the still early stage of testing in the United States, it is quite likely we're still off by 10 to 1. So if we're now at 140,000, the number is likely closer to 1.4 million than it is to 140,000. That's already. That's now. That means the death rates will be climbing. So far, they've been between 1 and 2% of the confirmed cases. That's the case fatality rate. Of course, that fatality rate goes down as you find more and more and more cases. But yeah, we've been running at a pace of roughly, it's closer to 2% right now. So figuring 2%, that means we're on track at this point for fatalities in this country to reach perhaps as many as 6.6 million people, a far cry from the 200,000 the administration is estimating. Now they can answer back and say, well, the case fatality rate is going to go down, as we test more and more and more. And they'd be right about that. It is likely to go down somewhat, but it's also true that many of those newer cases are fairly recent cases, And therefore, the people that are going to be dying from them have not yet begun to die. In fact, many of the people out there have probably not even been discovered yet because they've not gone to the hospital. And of course, they've not been tested. So that's the situation. That's the situation. Of course, when they go to the hospital, estimates are that it's probably going to cost to treat them somewhere between, I don't know, $20,000 and $70,000 per patient. That means a lot of bankruptcies if their insurance will not cover it, which it is likely not to cover very much of it. We're looking at huge bankruptcies. But of course, not if we pass a Medicare for All bill right now and make everybody included in it right now. And the government will be responsible for those bills. And we know the government can pay those bills. How do we know that? We know that because the government just appropriated $2.2 trillion for one of the bailouts, one of the coronavirus bailouts. And part of the $2.2 trillion was a $454 billion trust fund, which is going to be placed at the Federal Reserve, which in turn is going to fund something like a $4.6 trillion fund that will be used to make loans to bail out our large businesses based on the expected damage the coronavirus economy is likely to do to them, but has not yet even done. I'd like to remind you to share this because I don't seem to have too many people watching. I know I've got a lot of competition tonight, but at the same time, it seems to me things are very low right now. So anything you can do to help me share this would be greatly appreciated. Greatly appreciated. So, next, of course, it's not simply about the Medicare for All bills or the Medicare bill. Well, it's not simply about the health care bills. It's not simply about the health insurance premiums, okay, that are going to be going up. It's also about the rent. An article in The Intercept by Aida Chavez, written on March 27th, points out millions of people will struggle to pay rent in April, but few in Congress care. And she notes that the passing of the emergency multi-trillion-dollar relief package on Friday, which was approved by the Senate on Wednesday night and will now head to President Trump's desk, is about 5 times bigger than Barack Obama's 2009 stimulus and represents a massive upward transfer of wealth, which we explained a few streams ago. Though it includes a significant expansion of unemployment benefits and a one-time check of up to $1,200 for individuals and $2,400 for couples, it's going to take up to 3 weeks for people to begin receiving those relief checks, according to Treasury Secretary Mnuchin. That's going to be too late for the nearly 3.3 million people who filed for unemployment benefits last week and others who have become underemployed as a result of the pandemic. Some states, like New York, namely New York, have taken steps to temporarily block evictions. Congressional Democrats, with the exception of a handful of progressive lawmakers, have shown almost no interest in addressing the bills due in less than a week. Certainly, Nancy Pelosi showed no interest in that, right? It shows that Pelosi and the leadership still have their eyes on protecting corporations and not on the people, said one House Democratic staffer. We all could have said that, right? AOC said, I just don't understand how it's reasonable to expect what could be millions of people in small businesses who suddenly had their incomes cut off to pay rent, mortgages, and major bills on April 1st without any payment moratoriums or immediate relief. Over the weekend, AOC reiterated her call to suspend major bill payments to help stabilize working families. But her pleas fell on deaf ears. She, of course, was joined by Ilhan Omar and Bernie Sanders, also calling for a suspension of rent, mortgage, and utility payments nationwide. Senator Warren and other members of Congress joined Bernie's call for an eviction moratorium and student loan relief, though they have not called for a suspension of rent payments. So Elizabeth Warren is evidently on the side of the landlords and doesn't want a suspension of rent payments. House Financial Services Chair Maxine Waters last week released a memo of stimulus priorities that included suspension of almost all consumer credit card payments such as mortgages, car loans, student loans, and credit cards. She proposed suspending rent and utility payments for public and federally assisted housing residents, while providing payment assistance to help the non-assisted renters who meet certain economic conditions to cover their rent and utility payments. Under the Senate bill, student loan payments would be suspended for 6 months, but the benefit isn't automatic and requires borrowers to contact their loan servicer for help. So, anyway, rent suspensions have had the most momentum in New York. Last week, Andrew Cuomo announced a 3-month announced a moratorium of 3 months on all evictions for residential and commercial tenants. But tenants' rights coalitions like Housing Justice for All are pushing for a full statewide cancellation of rent payments. State Senator Michael Bagianaris responded to Cuomo's eviction moratorium by calling for the state to cancel rent for 90 days. He's from Queens, by the way. So, there are loud calls for moratoriums on those things. And meanwhile, a number of corporations, including Subway and the Cheesecake Factory, also plan to cut payments to their landlords or to go on a rent strike. And one activist in New York is calling for a rent strike. And she asks, quote, how can we convert thousands of people being unable to pay the rent into thousands of people who are taking collective, intentional political action together, unquote. I hope she finds a way. I hope she finds a way. Well, thank you for sharing. I see I have many more people here now. That's very good. So an article a little bit later on March 29th from Common Dreams. This one by Andrea Germanis. Headlined as April 1st nears and coronavirus crisis continues, demands to cancel rent swells. Public Citizen tweeted, cancel rent. Adi Barkan, glad to see he's still around, tweeted, the rent is due on April 1st. How are Americans supposed to pay when everyone has lost their job? Congress's checks won't arrive for weeks. And here I have to mention, if they had done what was proposed in Rashida Tlaib's bill and issued loaded e-cards to everyone, $2,000 per individual, those people would have the e-cards in a very few days. Their money would have arrived in days, not in weeks. Probably still wouldn't have arrived by the 1st because they didn't pass the bill in enough time. But it certainly would have shortened the period when they didn't have the possibility of making it good. Zephyr Teachout said, cancel rent. And Katrina vanden Heuvel, she was retweeting a Katrina vanden Heuvel statement. Shameless, shameful. The bill is a bonanza for real estate investors tucked into a stimulus package. And there are quotes from people who can't afford to make their rent. Forbes has reported on Friday, renters have some eviction protection. That's in certain states, they have some. But only if they live in a multifamily building or a single-family home that has a federally backed, has a mortgage that is federally backed. Landlords cannot evict tenants of these buildings or charge any late fees, penalties, or other charges for late rent payments, which is very good, of course. Fair housing advocates say that lawmakers have left renters shortchanged. And from National Public Radio, quote, many citizens say they're halting evictions if renters can't pay. But that's about it, says Laurie Goodman, co-director of the Housing Finance Policy Center at the Urban Institute. There have been very, very little actions taken for renters. In fact, the renter population is far more vulnerable than the homeowner population because, on average, they're just much, much less affluent and have much less in savings. She's quite right, of course. Alexandra Ocasio-Cortez said Gov's extended stay-at-home orders cannot be successful without issuing mortgage, rent, plus a moratorium on debt to go with them. And many people are going out because they're panicked about paying bills due next week on the 1st. Permanent suspensions keep people indoors. Bills bring them outside. And, of course, the implied additions. You stupid people in Congress don't seem to know that. You don't seem to understand you can't order people to stay indoors and leave them with bills they have to pay, which makes them go outside. And she might have added to that, don't put people in a catch-22, you idiots. Democratic presidential candidate and former Vice President Joe Biden on Friday signaled support for a 3-month moratorium on rent. There should be a rent freeze. No one should be evicted during this period, quote unquote, he said at a CNN town hall. Biden's rival, Bernie, stressed the need for a rent freeze as well. In a Saturday tweet, he wrote, along with pausing mortgage payments, evictions, and utility shutoffs, we must place a moratorium on rent payments, especially in states hardest hit by the coronavirus like New York. We must build on the important work of Senator Gianaris and others who are doing build on the important work that by Senator Gianaris and others are doing to make this happen. And Senator Gianaris has the hashtag cancel rent. So Bernie pointed to that. He talked to Teen Vogue about his passion he didn't talk to Teen Vogue. Joshua Collins, who's running for Washington's 10th congressional district, talked to Teen Vogue about his push for a national rent strike. A need for the action, he said in the interview published on Thursday, is clear. Because people have very little money right now. People have their hours cut or have been laid off entirely. And if you collect unemployment, if you're even able to get on unemployment, it's only a small portion of what you made before. People were already living paycheck to paycheck. And that on top of that, if someone is doing some sort of payment plan for rent, I don't want someone to come out of this with an insurmountable amount of debt they can never pay off, right? If the student loan crisis has taught us anything, it's that even if it's only like 5,000 to 10,000, it might take a lifetime to pay off. Some renters in Chicago are gearing up for such a strike. And there's a petition in Chicago to Mayor Lori Lightfoot, crafted by the Autonomous Tenants Union. It says the freeze should be in place not just for 30 days, but indefinitely for as long as a risk to public health remains. The call is backed by local officials, including by the state rep, Will Guzzardi. The moratorium we're calling for, yes, it is an extraordinary policy intervention, he said to the Chicago Tribune, but this is an extraordinary moment. It is a highly extraordinary moment. And meanwhile, what's going on the right while this is happening? Well, they're not normally considered right, but they are the reasonable right. The Fiscal Times reports. The Fiscal Times is the house organ of the Peter G. Peterson Foundation. And there's an article there called, What's After the $2 Trillion Rescue? Pelosi plans a big stimulus. So what is this big stimulus that Nancy is planning? The article starts off by pointing out that Trump just signed a $2 trillion bill. And Yuval Rosenberg, who wrote the article, says, quotes the Wall Street Journal as saying that legislators from both parties, administration officials, economists, think tanks, and lobbyists Already roughing out the contours of yet another emergency spending package, perhaps larger than the last, to try to keep the coronavirus from turning into a 21st century Great Depression. And many expect the debate to begin in earnest by late April. By late April, it better not wait till late April, or we won't be able to shape the debate. We have to begin the debate right now. So Nancy Pelosi is said to be prioritizing help for the states. The legislation passed last week was mostly aimed at minimizing the wreckage from the forced economic shutdown that has choked off business revenue and worker wages. I think it was more about doing something about choking off the possible business revenue, which hadn't started in earnest yet. The next step reportedly could involve more economic stimulus while also extending the benefits in the latest legislation and addressing the gaps it left. Most notably, more aid to state and local governments whose budgets are sure to face massive shortfalls due to lost tax revenues and emergency spending needs. Nancy Pelosi said, quote, "We have to have more resources for state and local government. This isn't about how fast we can do it. It's about how fast we must do it," unquote. But, says Yuval Rosenberg in the Fiscal Times, partisan differences could quickly reemerge. There's some disagreement on just how urgent additional action is. Of course, they don't feel the same sense of urgency now that there's a $4.6 trillion trust fund for large businesses enacted into law, right? Their emergency has been taken care of. The emergency of the rest of us, though, hasn't. And some early signs that the unusual speed and cooperation Congress displayed in scrambling to pass the $2 trillion Phase 3 package could be harder to come by for future legislative steps as ideological differences bubble up again. Guess what? Are we about to hear, just a few days later, once again the refrain, "How are you going to pay for it? We can't afford it. The debt, the debt." Quote, "The left is going to want to do infrastructure, welfare payment, and food stamps," unquote. Stephen Moore, a fellow at the Conservative Heritage Foundation and an outside economic advisor to the Trump administration, and some congressional Republicans told the Journal, "Our side will want to do tax cuts and deregulation." Of course, Stephen Moore always wants to do tax cuts and deregulation. And he's also a notorious Goldie who wants to go back to the gold standard one of these days, so he can really starve people good and proper. Some Republicans also want to tap the brakes before considering additional action. That's hesitation fueled, in some cases, by concerns about a more permanent expansion of government. I would hope anybody that's talking about a Phase 4 would pause right now. House Minority Leader Kevin McCarthy, the California Republican, said Friday on Fox News, quote, "Let's make sure this is actually working in the process and be smart. Get the data back of where, if we do need more help," unquote. Kevin McCarthy took care of his big business constituents in the Phase 3 bill. They're the ones who needed the bailout right away, so Kevin's donor money could keep on flowing. So he took care of them, but now we have to make sure this is actually working in the process and be smart. Get the data back of where, if we do need more help. But guess what? We can't get the data back from the slush fund because The FOIA rules for that were suspended, and the loans will be granted to big business by Mnuchin and Trump in secret. We won't know who or how or why these loans have gone to. So what data are we going to get back? You won't get any data about what the hell these businesses are doing with this $4.6 trillion. They could be doing anything with it. They could have on such a colossal gamble that the world's whole economic system will collapse from that gamble rather than from the coronavirus crisis. And by the way, this article, in calling attention to what Phase 4 is going to be like and the gaps left by Phase 3, since this article comes out of the Fiscal Times, it doesn't say anything about further hospital needs, even though the hospitals are still crying for equipment. Right? Right? It recognizes the budget crunch for the states is going to be real. And that we'll probably hear more about it as we approach July 1st, which gives Kevin McCarthy time to see what's actually working and what's actually not. He's probably going to want to bail out the states, maybe a little. He might want to do some infrastructure. But is he going to want to give any more money to the hospitals to treat people and to end the deaths from the coronavirus crisis? Is he really going to want to do that? Are they really going to work on infrastructure? And if they do want to do something about infrastructure, are they going to work on green infrastructure? Or are they going to work on more fossil fuel servicing types of infrastructure? Are they going to do anything about the Green New Deal? What are they going to do? What they do is going to depend, at least in part, on how loudly we scream, how quickly we get in, how quickly we begin to talk to the Congressional Progressive Caucus to have Jayapal and Pocan and other leading progressives get real active in crafting a plan that they want to see get funded as part of Pelosi's Phase 4. And don't forget also Rashida Tlaib's plan. Turns out Fiscal Times didn't have anything to say about Rashida Tlaib's bill. I wonder why. Okay, I'm going to move now to consider your comments and your desires for the next round of this struggle. And Russell asked, is this a new system? No, it's not a new system. It was not a new system. Don't pull another Biden. I'm not pulling a Biden. I'm nothing like Biden. Please do some more shares for me, folks. I need more shares. Hard to believe the Biden is still coming out negative on Medicare for all. Hasn't anybody told him that his advocacy for free trade and his advocacy against Medicare for all is going to cost him the election? Because Trump will tell us another pack of lies about the wonderful healthcare system he has in the works. And of course, he already has a better record on the TPP in the actual treaty he negotiated than Biden did, because the TPP that Biden advocated for still had the ISDS stuff in it. So Trump has already delivered more than Biden wanted to enact. And he's still in the same position on trade as he was before. He's not sorry. He's not sorry that all those auto workers have lost their jobs at all. When the auto workers finally find that out, they're not going to vote for Biden. I mean, there goes Michigan again. There goes Wisconsin again. There goes Ohio again. There goes Pennsylvania again. Maybe insurance companies should also make it their business to be ethical. Insurance companies are private organizations. They're in it for profit. You can't make them be ethical. At one time, there was a lot of social pressure on them to be ethical. And they tried to be in the 50s and the 60s. There was such a thing as social responsibility for business. It was one of the things they talked about. They even hired some people, to develop some programs in that area. But then the stock market of the 80s happened, the rah-rah, go-go market. And the greed is good ideas. And with them, ethics and social responsibility went out to the window, and it's been that way ever since. It's been that way now for 40 years. Okay, and Evelina says, wouldn't be Biden if he didn't. Bonnie says, hi everyone, please stay safe and well. Kay says, shared. Lana says, same to you. Yeah, we're making every effort. We're awful careful when we go out. Which we did today. We went shopping today. We still could find only very small boxes of tissues. We couldn't find any toilet paper. Of course, we're still packing many rolls here, so having had some foresight, we just kind of look to see if the shortage of toilet paper is over. But it's not. I don't know what Americans are doing with all that toilet paper. Steve says, many subways are closed here. My Citibank branch is also closed. Oh, wow. The banks are closed. Wow. Well, you can do your banking online, though, right? Rick has joined. Hey, Rick Maynard. Evelina's joined again. Rosemary Robinson's joined. Susan Eldridge has joined. And Kay has joined. Bernie had a great online town hall tonight. I know. I didn't have a chance to watch it yet, but I'm going to watch it probably before I go to sleep tonight. Certainly early tomorrow. I really wanted to see that town hall. I just didn't get a chance because we were out shopping and I didn't have too many hours to, today to prepare, so I had to prepare. But I love but the people he had on today, especially Cornel West and Reverend Barber. They are great people. Great people. Dale Weaver said, "I missed that, Kay. Thanks. I'll have to go back and watch it after this." Yeah, I'm sure that was a really, really good one. And I think Bernie is starting to get more forceful again. I think maybe he's beginning to perceive that maybe he still does have a chance at this thing. Because Biden is self-destructing. Kay says, "I'm getting as fed up with Cuomo as I am with the orange idiot." SMH, he's as GOP light as Dems get. No, Biden is as GOP light as Dems get. Steve says, "It's becoming obvious that we will need many of Bernie's policies to recover from that. We'll need all of them to recover from that, and more." We'll need Bernie to use the platinum coin in overt congressional financing. Tay says, "Exactly, Steve." Steve says, "Time to consider the People's Party." It is. Long past time. Lana, how did their conference call go tonight? And what did they decide to do? Lana said, "I broke down and ordered TP on Amazon. Has Amazon got any TP? I didn't even try to order it on Amazon." Or maybe if Amazon has some, Costco has some. We haven't wanted to go into Costco. We thought it might be good to stay away from there for a while. Too many people. Of course, we know they're only letting 30 people in at a time, so they are trying to maintain social distancing in the store. We went to Trader Joe's today, and they were doing a real good job with social distancing. And Steve Wolfbrand said, "I saw part of it too, Lana. Looks good to me." And Carbon Muniz has joined. A lot of bank branches are temporarily closed. Now, if we could fund Bernie's campaign, we could fund the People's Party to at least start up, too. I mean, we the people have generated more than $100 million so far in this campaign for Bernie Sanders. I'll bet the People's Party could do a hell of a lot of damage if we could raise $50 million for them. Lana says, "Please sign up for the email so you can join the conference calls for the Movement for People's Party." Yes, do. Lana said, "Pretty well. I missed the first 10 minutes. Steve said, "Doc, what about the DNC penalizing states that postpone their election by giving them less delegates?" I don't think the DNC is going to do that. I mean, this is ridiculous. This is the coronavirus. I mean, Perez is already taking tremendous heat for pressuring people to hold the primaries, a couple of weeks ago. And now reports have come in that at least 2 workers came down with the coronavirus because they were working at the primaries. And if they found 2 cases, there are probably 20 cases more they didn't find, but they will. They will. So Perez is going to be responsible. He's going to be responsible for urging those people to do the primary and get the coronavirus. They're not going to penalize people for postponing their primaries. That's a joke. If he does that, He has absolutely no chance of staying in as the chairperson of the DNC. Absolutely no chance. Carmen Muniz has joined. It says a lot of bank branches are temporarily closed. Kay says only the drive-thrus are open mostly. We haven't been to our branch for a little while. We're probably going to drive over there since we're getting to the point where we need a little cash anyway. And Kay says both Biden and Cuomo has been cutting Medicaid and closing hospitals this whole time in New York. I know. I understand there used to be 52,000 hospital beds, okay, in New York, and they now have only 32,000. And they have a need for 130,000, which number they would have been a lot closer to if he hadn't closed those 20-odd thousand hospitals with the hospital beds down. Lana said, yes, the TP came over the weekend. The whole case! Wow. Steve said, Lana, because they know Bernie could win those. And Carmen says, I just awoke from another headache. How long has this stream been on? Sorry, I missed the beginning. Oh, that's okay, Carmen. We started tonight at 9:30 because I had kind of a late start because we were out shopping. So it's gone on for about an hour now. And we're down now having a conversation with you about what your progressive priorities are that we need to fight for. You need to tell me what they are. You need to tell me what the priorities are. I need to hear them from you. Kay says, sorry you're having headaches, Carmen. Steve Wolfbrand says, probably the safer to pay without cash. Who knows where it's been. Yeah, mostly we do pay without cash, but we have to use some washing machines in the building to clean our stuff. And we need some cash for the washing machines. At this point, that's about all we need cash for, is actually the washing machines. We need some $5 bills. Anyway, when we get the cash home, we're going to disinfect all the cash with disinfectant wipes, and then wash our hands real good. So we'll be careful how we handle it. We know that cash can be a problem. Carmen says, thanks, love. Been getting them every day again. Okay, says probably stress related. Carmen says, thank you, Steve. And my camera's gone south again. Hopefully it just come right back on. Sorry about that, folks. Another interruption. But it's been steady for a long time now, so After the first 4 times it went off, it settled down until now. So I think that was pretty good. It's been almost an hour since it last went south on me. Oops. When it rains, it pours. It's back again. Steve says, that's good, Doc. Take care of yourself and Bonnie. Thanks, Steve. Carmen says, I hear you can microwave cash to sanitize, but would that damage the strip? I don't know. I don't know if it would damage the strip. Steve says, try eating something. Could be blood sugar related. Carmen says, Steve, yes, probably are. I have diabetes. Steve said, that's good, Doc. Take care of yourself and Bonnie. We take care of each other pretty good. Kay says, I'm okay so far, Steve. Okay, guys, I need to hear more about your priorities. What would you like the Progressive Caucus to work on? To go to Pelosi with, to say, this has got to be handled. This has got to be handled. I think we need Rashida's bill to be tucked into something Nancy Pelosi wants to do. And we need to prevail on her to use platinum coins so she doesn't have to worry about any more debt. So she knows it's not going to increase the debt. So Steve says, is it true about ibuprofen? What is it concerning ibuprofen that you're asking? Lana says Medicare for all, yeah, and immediate payments to people. And platinum coin financing. Okay, let's have some other priorities. Steve, what are you asking me about ibuprofen? Kate says, I'd like the progressives to take over. And so would I. But we got to get the establishment forces out of the way. And Carmen says, how to disband the DNC's private entity status so they can stop overriding the democratic process. And Kay says, Steve, we got some Tylenol just in case. For COVID-19, it's been said Tylenol and also no non-steroidal anti-inflammatories. Also no steroids. Yes, I've also been told that that Tylenol is the only thing that may actually not actually prolong the time when you have the virus, because the fever reaction to the virus is what you should have, and is the body defending itself against the virus. I've also been told through some YouTubes, okay, from the medical people, that one's fever can go as high as 105 degrees Fahrenheit without it being a serious danger. And if it goes up fairly high, then that's likely to help you to recover from the virus more quickly. If you take the NSAIDs, they could cause side effects and could actually prolong the disease. Steve says the Progressive Caucus should go to Pelosi with a noose. Yes, I think it is true. Okay, according to John Campbell, the English physician who's been live streaming every day, that is a conclusive finding that ibuprofen is likely to make COVID-19 worse. Steve says it accelerates the symptoms. Kay says steroids kill your immune system. Steve says Tylenol is bad for the liver if you drink alcohol. That may be, but in this case it's a matter of trading off different things, and it seems as though what you should do is take the Tylenol and stop drinking the alcohol. Kay says oral steroids will cause diabetes too. And Steve says refresh. LOL BRB. Carmen says maybe drink some hot teas. That's what I did for a larynx type infection today. Knocked it out of the park. Jasmine tea with hot lime. A whole 12-cup pot. You finished a 12-cup pot of tea? What is this crap about AOC moving to the center? I don't want to believe it. No, it's based on some actions of hers or failures to act. Like, for example, this election, she hasn't given an endorsement to Cori Bush, who was running again in the primary for Congress. And Cori Bush could really use her help. If you recall, in 2018, after AOC won her primary, she was campaigning for Cori Bush. So it seems that AOC has not been supporting Democrats who are challenging incumbent Democrats, except in the Jessica Cisneros case, and the Marie Newman case. It was generally recognized that those two congresspeople were really, really Republican lights, and that but they were terrible. So that her opposing them was more acceptable than her going into some other districts, like into Cori Bush's district, to oppose someone who's more establishment and not quite as obnoxious. Lana says it's a kidney killer too. Drink lots of water if you're sick. I would think the booze would not be a thing. Carmen says, yeah, not as good as wine, but it helped. We don't drink a lot of wine as it happens. We're very limited in our consumption. You just see me at 9 o'clock having my the last of my zone diet allocation of wine for the day. And Russell says, if this link is accurate, I may not try to restart my business until June 1st of 2020. Study it later. You can pull up the trends, okay, and protections in your state. Okay. Yep. Okay. I think you mean the projections. I believe that things are not going to peak when Trump says they are. They seem to be thinking that our death rates, our case rates, and fatality rates per day are going to peak in about 2 weeks. I would be very surprised if they peak, okay, in 2 weeks. We have had so little testing. We have no idea how many cases, okay, are out there. I think as the testing accelerates, we will find that if we're lucky, we may be talking about a peak in new cases per day and in fatalities per day around the 1st of May. And then, before we can be cleared to actually start seeing people again, it may not be until June. Of course, then we'll be able to see people in small groups. And Russ, I guess, for your business, you only have to see people face to face. I think you still may want to be wearing a mask, and if it's feasible, wearing some gloves to do your work. Steve said, isn't Cori Bush sick with the COVID? Maybe I'm thinking of somebody else. I don't know. I didn't hear that. She may be, for all I know. Haven't been paying that close attention. Kay says, I drink my few good night beers every night. I laugh out loud. Carmen says we'll need much more economic stabilizing stimuluses. Yeah, I think so. I think we need Rashida Tlaib's bill. He says, I think AOC got mad at Bernie about something, forget what. I don't know what she got mad at him about, but there are many people who are angry at Bernie for not legally contesting the primaries where the exit polls are very much at variance with the actual count. He's not used his money, he's not used his resources to contest those particular primaries. And I think she probably figured if he's not going to fight for it, then why should she? I mean, she endorsed him because she thought he was the only one who was going to fight. And here he is. And he's not really fighting. He's not really going after Joe Biden, as he should be trying to do. Carmen says, right, Dr. Campbell mentioned the virus must be exposed by mass frequent testing. Of course. Thanks, Carmen. I got the correction. And Lana said, yes, I read that Cori is ill. God, I hope she gets well quickly. And Steve said, nobody is tuning pianos, Russell. And Gina Marie says, here. Hi, Gina Marie. How you doing? And Steve says, forget the question mark. Sorry, it's a question. He said he forgot the question mark. Sorry, it's a question. No, nobody wants people from outside to come into their homes because you don't know where they've been and you don't know what they may be bringing in. So someone who's a piano tuner and has to go into people's homes has that to contend with, and that's a problem. Someone sent a link with a DR purporting a water mister with a hair drying, blowing heat down the throat, if you've got it. What is that supposed to do? Is that supposed to wash down any viruses that may be in your mouth? Steve says my profession is hurting as well. Lana says I saw up one's nose, not down the throat. Okay, I heard some good news from John Campbell today. The Mercedes Formula One team has come up with a new mask, through which can be placed on a person's face. Okay, and but can be connected to compressed air, okay, and oxygen, and can be used to inflate your lungs, okay, and to stop the virus from filling up your whole lungs, okay, and stopping you from breathing. Okay, and this is done in a relatively non-invasive way compared to a ventilator. There's no need for a tracheotomy, and there's no need to be hooked up to anything like a ventilator. And evidently these devices can be manufactured very quickly, in the thousands. And for many cases, can be used instead, okay, of ventilators to help people to continue to breathe and give them time to heal from the virus. So that's potentially a very, very important development, because it can really ease the problem of the ventilator shortage. People can go to the hospital and, they can get that, and it's a lot easier to hook them up to that and have that work for most of the people and ease the ventilator shortage. Now, how quickly they can get that out to hospitals, I don't know, but I think it can be in the thousands per day. So it's a development which is significant, but have to hear more from John Campbell in future streams. Carmen says, we need Medicare for all. I don't see how the federal government can keep denying it now that folks see the trillions that they whip up on the spot, mostly for corporations yet again. Well, we have to circulate the truth about what they did for the corporations and point out that the federal government can create money at will, and that there is no barrier to paying for Medicare for all. It can be paid for each year with trillion-dollar coins. It can be paid for, okay, in other ways. But if you want to keep paying for most of it the way they're paying, that we're paying for medical care now, and then pay for the rest, and for our copays and deductibles and premiums, through using platinum coins, that's perfectly practical, perfectly easy to do. Ross says tons of cancellations, plus my county is a stay-home order with a possible $1,000 non-compliance fine. So I have canceled most until the stay-home order is lifted on April 13th, 2020. Lana says spray face with some water and send warm hair dryer, not hot, up the nostril. Steve said it doesn't like the heat. Steve said bummer. Carmen Muniz says German engineering once again coming to save the day. Steve says they usually do. Carmen says Japanese too. What's wrong with American engineering these days? How big is the trillion-dollar coin? Just curious. 1 ounce. It's a 1 ounce platinum coin. The value of the coin has nothing to do with the value of the metal that is used in the coin. The value of the coin is determined by its face value, and its face value is prescribed by the Secretary of the Treasury, who can order the mint to mint a particular coin with the face value as large as the Secretary of the Treasury wants to specify. The face value of the coin could be $1 quadrillion if the Secretary of the Treasury wants to do that. And Gina Marie says, I work for a corporate insurance company, Anthem. They have an active campaign against Bernie Sanders and own our federal government. The lobbyists' money and talking points. Even own their own research institute. Yes, I know they do. Otherwise known as Blue Cross Blue Shield, right? Steve says, what if the coin got lost in the couch cushions? Just saying. If it got lost in the couch cushions, then they simply could mint another coin. The point is, if they took what was in the couch cushions over to the Federal Reserve and they tried to deposit it there, then the Federal Reserve would know that it wasn't their coin, but it was the coin that got lost in the couch cushions. So they wouldn't be able to collect on the quadrillion-dollar coin or the $1 trillion coin, or whatever. Carmen says, coups are everywhere against Bernie and we the people. And they are. So we have to put together some of our own defenses against that. Okay, folks, I'm going to say good night for tonight. It's been a very nice conversation. Thank you for coming, and thank you for staying. And I'll see you tomorrow with what I hope is another scintillating live stream for the people. Thank you very much for coming tonight, and please share this.